Hi guys, how you guys doing? So for today's video, I'm just gonna give you a quick overview of the chest tube. Come with me. So chest tube, there's different reasons why someone will have a chest tube. It's probably someone that is, pneumothorax, someone that is maybe has some empyema, someone that has like a pneumo, or maybe your cardiac patients that came back from surgery to prevent tamponade. So they probably will come back with a chest tube. So you have your chest tube in place. Just so you guys know, when someone is coming to your bedside, maybe a surgeon, they're coming to place a chest tube on. Some of the things that we want to make sure that we're doing just to make sure that they're ready for the chest tube is not only that we're going to be setting up our Pluovac, just so you show it really quickly. So the Pluovac, what does it come with? It does come with a stand that allows the chest tube to stand. Other things that it's going to have is it does have this area here, which is for suction. It has a suction port. You're gonna have two orders for chest tube, whether it's to suction or it's to water seal. If it is to suction, then we're going to be connecting our suction through here. We're always going to put some liquid on here as well. It's going to be 20 cc's of sterile water. So if the patient has a chest tube, we're going to be putting in the sterile water from here. Just so you know, if you do get a new Pluovac, it is going to come with your syringe already pre-filled, and you're able to just go ahead and place your sterile water through here. It's going to be about 20 cc's, or until you see the line. You can get a little closer because it does have the little lining here that tells you where to stop. Okay, so that's where you're going to do. The coloring does turn blue, which is very beneficial because the blue coloring kind of helps us to determine. It does have the injection point for the fluids, and it also has the pressure release right here as well. Okay, so what we're going to be looking at for this patient is if it is to suction, just know that this right here, the dry suction chamber, this is what controls the amount of suction that the patient has. It'll come to like -20, maybe 15, based on the physician orders. This is where you will set this up. If it is ordered to suction, just make sure that you're looking at the orange ball here. This is supposed to be either halfway floating or it's supposed to be all the way up. Just make sure that it's not all the way down, because if it is down, so you can see a little closer, then that means there is no suctioning that's really happening. So this is all the components of the chest tube. So let's say if this is not floating or it's all the way up, one of the things that we could do to troubleshoot that is we can look at our wall suction. In that case, we're able to increase the wall suction just to make sure this here is up. Okay, so that's one of the things that we have to do. When we have a chest tube, some of the things that you want to make sure that you do have the bedside for this patient is you want to make sure that we do have, gauze in place, 4x4 gauze. Sometimes they will have those sponge gauzes just to make sure that it goes through, which looks like this. It is nicely connected to the patient, and it also will have some tape as well. So those are things that you want to make sure that you do have at the bedside. With the chest tube, some of the components, it also comes with, like I said, we want to make sure that you are not clamping it unless you have a physician order to clamp. One of the things that we want to do is there's two different types of order for chest tube. It may be to water seal or it may be to suction. To water seal, it just means that we remove the actual suction part that is not connected to suction. With that, the patient is able to ambulate, they're able to go to their scans with it to water seal. Okay, but we want to avoid clamping as much as possible. If the chest tube was to come out, one of the things that we want to do based on your hospital policy, all right, so just make sure that the gauze is in place. One of the things that I forgot to mention is sometimes with the chest tube, it may have a stopcock in there in place. A lot of times the physician will have it there in case the patient needs some antibiotics or anything like that. Then we're able to go ahead and insert it in that area here. Just know that when we are changing the Pluovac, it's gonna be changed around here. You always wanna keep as clean as possible. That when you are disconnecting it from the patient, it's gonna be through here where we're just changing the whole Pluovac. We do not keep it. It gets into biohazard, we toss it. This area here is for us to get any sample that we need for the patient for the chest tube, okay? Wanna make sure with the, okay, so here, this is where you wanna make sure that there's no bubble, there's not a lot of bubbling happening. If there's no tidling, no nothing happening, that could be an issue too. Too much bubbling may mean that there's an air leak happening on this patient. Nothing, no movement at all means there's probably no suctioning happening, or maybe the patient has an obstruction. If the patient has an air leak, the numbers at the bottom, it has 1, 2, 3, 4. based on the numbers here, if bubbling happening, it tells you exactly the degree of the air leak. So we're able to communicate that with the physician as well, how much of an air leak the patient has. All right. I love you guys. The best is yet to come. Love you.